So again, we talked about the CPT book being organized in sections or like chapters, and there will be a quiz question on these 6 chapters. Here they are listed for you on the screen, on the PowerPoint. Evaluation and management is a big one. We're going to do that right away because more than likely when you go to clinical, you're going to have to deal with a lot of this. This is a lot of doctors' offices. These are doctors' visits. Okay, which makes sense when you think about the name, evaluation and management of the patients, of their cold, of their pneumonia, of their bronchitis, of their infection, of their skin disease. Any doctor's visits fall in this section. And then anesthesia. Surgery is a huge section. It's going to be the biggest because within surgery, we break down into every body system and procedures that can be done inside that body system. Okay, so surgery is a big one. Radiology is going to be your x-rays, CAT scans, MRIs, things like that, ultrasounds. Path and lab is a blood test. Okay, cultures for organisms and bacteria, things like that. And medicine's kind of a dump chapter. There's a lot in medicine, and we'll go through that when we get to it. And then at the end of your CPT book, towards the back, you're going to have Category 2 codes listing, Category 3 codes listing, which you don't have to worry about those right now. The appendices, and really Appendix A is the only one that we're going to use because it's full of all of our modifiers. Okay, and then the index is what you're going to use hugely. That's where we start. We actually start when you're going to code at the back of the book in the index. Well, that's where we look up everything. Everything's alphabetic in the index. Your code book, when you're going through it and looking for codes, is kind of categorized and organized. You can see at the very beginning, and if you flip in your CPT code book while we're talking about the PowerPoints here too, you can see in the surgery section, we go to the nervous body system. That's the subsection. And then underneath the nervous system or within, you can see the subheadings in the skull, meninges, and brain. Then you can see the category, any injections, any drainages, any aspirations done in the skull, meninges, and brain. In the nervous system are going to be listed here. Okay, so some checks and balances to make sure you're in the right spot when you are reporting your codes for your homework. Okay, so take a look at that. Look through the CPT book and kind of pay attention to how to read that. These are all ways, this whole slide, it really is, as a heading, I would say, ways you can look up your codes. Okay, they might be categorized by your body part or your anatomy, by the procedure. Is it an incision or excision or repair or removal? You can go to those codes in your index and find where to look in the CPT book for the actual code. The condition, it can be listed by description. Sometimes some of these procedures have formal names, and then also the surgical approach. This slide doesn't make any sense. We're going to skip that. Guidelines. Guidelines is a big deal. What I want to tell you is the bullet here says section-specific information begins each section. Remember those 6 sections? Evaluation and management, anesthesia, surgery, okay, radiology, path and lab, and then medicine. At the very beginning of every single one of those chapters are green pages. These green pages are the guidelines, just for that section. Okay, if you're stuck doing homework or in a test and you got the book there, go to your guidelines. Maybe your answer is written in there. Okay, we have a textbook here this semester and a workbook. Okay, your workbook, all your assignments are going to come out of that. The textbook basically teaches us how to use that code book. Okay, when you leave here and you go get a job and you're coding, you're going to have that very same exact code book. We're going to make a ton of notes in it. You're going to take it with you. Okay, so you're going to be loaded with information. Okay, when you get done with this introductory and then the advanced coding class. The guidelines are great. Make sure you don't forget about them. They are there to help you. There's also notes everywhere. Okay, there's notes above your code. There's notes below your code. There's notes at the beginning of the section or the subsection. Look for notes. It's a huge thing with CPT not to hurry with your homework. Okay, I know you got to get this homework done because then you got this one and then you got this one and you got this class coming up. You need to take your time with CPT because you can get your code, read it to make sure it makes sense, go back to look and make sure that it makes sense with what you were looking for, Read above it for any notes that might help you. Read below it for any notes that might help you. And then go on. Okay, you kind of have to shop around a little bit in CPT. You don't get to do that in ICD-10 as much. In CPT, we do. There are two types of codes, and this is how you read CPT. You can have standalone codes or indented codes. Standalone codes are left justified. Okay, they're going to be all the way over left justified on your column. They give you a full description of the procedure, and you read the whole thing. Then you have codes underneath those that are indented. Okay, and if they're indented, it means they're dependent on that preceding standalone code from up above, the last left justified one up there. So any verbiage before the semicolon applies to all the indented codes that follow. So this is an example. Here's two codes. Do you see one's left justified and one isn't? Okay, one's a standalone code and one's indented. If I've read the whole description for 26010, it says drainage of finger abscess, simple. See the semicolon? Okay. If I wanted to read the definition of 26011, I would say drainage of finger abscess, there's a semicolon, I have to stop. Skip down. Complicated. Drainage of finger abscess, complicated, for example, or e.g., felon. That's my full definition for code 26011. Now, it is not correct to say all of it. You don't want to say drainage of finger abscess, simple, complicated. Simple, complicated don't make any sense. Which one is it? You can't do that. You stop at the semicolon and jump down. Okay? So any indented code, if you want to read that whole description of that procedure to make sure you have it right, read all the way on that left justified one until you hit the semicolon, stop, jump down, and then read the rest of it. That's super important. You're going to get a lot of codes wrong if you don't understand what I just went through. Okay, so make sure. Again, the semicolon indicates that you have a full description in the preceding code, but you have to return to that standalone code for that full description. Okay? Modifiers, just going through these quick, we do a whole chapter on these as well. When you see modifier 62, see that dash in front of it or that hyphen. When you see the hyphen, you say modifier. Okay, so when we see the screen in two places, we'd say modifier 62. Okay, they give a little definition of modifiers, and these are always in Appendix A. And as the slide says, modifiers add information. Modifiers do add information. They tell more of the story, is how I describe it when I teach it in class. I can do this whole procedure, and here's the code for it, and that's all great. But I actually had two guys in there. This is where modifier 62 could help. Okay? It would tell more of the story, and sometimes it can get me paid more. Okay? Which is always a good thing. So modifiers, you might see some of these alpha ones. Now, I said in previous recording, I don't want any alphas. I don't want any alphabetic letters in any of your homework answers, okay? There are a couple little places where we will use them, and they're on the modifier side of things. So they're at the back of your 5-digit code. You might use some alphas back there, and we'll get to these. These are also at the very front of your CPT book. So if you open up your CPT book, right in that front hard page, you can see them and look at them there, and we look at them later. Here's an example of a use of a modifier. It says a gastrojejunostomy in CPT is code 43820. Wouldn't you rather say 43820 than gastrojejunostomy? If you added a modifier 62 to it to say that we had two surgeons in the room working on the patient at the same time, you would say your answer would be 43820 with a modifier 62 added to it. Okay? We can get more money for that. Every physician's going to get paid. Okay? There's a spot for modifiers on the claim form, which we already went through the claim form earlier. We kind of skipped over it because we do it a lot in reimbursement class. It's not that big of a deal that you understand it. But you can use up to 4 different modifiers. So you can add a lot of different information to that story, okay, to make it right. Unlisted services, I just want to say something really quick about these. At the end of my slide, in this big white space here, I have hardly ever use. Okay? Unlisted services. I coded for 12 years on the outpatient side of things for many different doctors doing many different things, and I absolutely never had to use an unlisted service code. Not once. Okay? These codes end in 99. So it could be 45399. Remember, we have 5 digits. It could be 97199. 12199. Any code that ends in 99, okay, should trigger to you and be like, oh, that's an unlisted. Okay, they really don't have a description. Their description basically is used if there's not a more specific code. Okay, we only use this as a last resort if we can't find another code that makes sense, which 99.9999% of the time doesn't happen. Okay, and to get paid, we have to send in lots of information, medical reports and things like that. So there are unlisted services. You can find them if you just go looking through your CPT code book sometime. You can find them, and they're at the back. They're kind of at the end of every section. Underneath every category, you'll find a code that says 99 at the end of it. You're not going to use a lot of these when you're doing homework, okay? I won't ask for them for answers. You'll always have something more specific usually. Category 1 codes, I just want to say these are the ones that we're learning about, okay? All of your answers this whole semester are going to fall in this range of codes. Category 2 codes are used for performance measurements. We're not going to talk about these a lot. We're going to get into these in advance. So please don't answer me and give me homework and hand in homework that looks like a code on the screen. Because that's alphanumeric, and I said I don't want any of those, right? Okay, so please don't do that. We won't use that until advanced coding. There are some kind of cool things in CPT. I don't get to a lot of them. This is for new technology. So there are temporary codes out there. They can be temporary for up to 5 years. They identify any new ways of doing things, emerging technology, a new service, or a new procedure. They're located after the medicine section, so all the way at the end. And they look funny like that. 0042T, they have an alphanumeric. Okay, they have that alphabetic on there. So anything new that comes out that we're doing at our facility, there may be a code in this section for it. Instead of using that 99 unlisted code, you might be able to find something in here. Okay, we're not going to deal a lot with that in class. Category 3 codes, we're going to skip that slide too. Special reports are just what we need to report if we use the 99 codes, and that's not a big deal either. The index is huge. Okay, I feel like we're doing that at the end, and this is really where we start. The index is used to locate your service or procedure terms and then find some codes. It speeds up the code location. It's like a dictionary. It's all alphabetic, okay, in order. There's first entries and last entries, okay? I want to say, and I want you to make a note of this, never code from the index. The index is where you start. So we actually start backwards in coding class. We start at the back of the CPT book in the index. Okay, indexes in books are normally at the back, right? And they're all alphabetic order. So find what you're looking for. Removal of toenail. Okay? So you go to removal. You read down through removal and find maybe nail. It'll give you some 5-digit codes to then go back in the middle of your book, the body of your book, and look up and see if these are the ones that you want. Okay? So we start at the index. We start backwards. All right? So your index, if you go look at it, you can see at the top it's kind of dictionary-like as well. Repair iris, okay, and there's a bunch of codes. Repair toe is the last entry. So that's very dictionary-like. And then the way the codes read, you have to be careful. If you have a single code, great. That's probably your answer. Go look it up and read it and make sure. If you have multiple codes, it means it could be this code or that one. There's a comma in between them. If there's a whole range of codes that it could be, you'll see the hyphen in there. That means anything in that area could be your code selection. Okay? So locating your codes, you might find them lots of different ways. 2 students could find the same code 2 different ways, and that's okay.